אקדחים עם תחמושת.
They were shooting through the windows. There were artillery shells by the gates. We came out at 7:30 a.m. and did not know what to do or where to go. They asked us to leave Kamal Adwan and head to Fakura. The way there is no road, just deep sand. My father kept having to pull me out of the sand. Piles of sand that is difficult to walk in with an injury.
The patients that were evacuated now have been held for interrogation for 24 hours despite their injuries. The occupation did not care that they were injured and left them out in the cold for 24 hours. And they were left on the Nazle roundabout, and we as paramedics got to the closest point despite the dangers and evacuated a large number of patients.
אקדחים עם תחמושת.
Come regularly. I mean, the last 2 weeks we've been 4 times here. Yeah, we will continue.
للأسف لم يتبقى إلا طبيب واحد معي الآن في مستشفى كمال عدوان. مستشفى كمال عدوان فيها أكثر من 145 مريض. طبعا اليوم سيتم نقل إخلاء 20 مريض إلى مستشفى شفاء، ولكن صراحة هناك أعداد كبيرة تحتاج إلى تدخلات جراحية، ونحتاج إلى السماح بإدخال طواقم جراحية لإنقاذ ما يمكن إنقاذه من المرضى الجرحى المتبقين في مستشفى كمال عدوان. الوضع كارثي بكل ما تعني الكلمة المعنى، لا ماء لا دواء لا طعام، وإن كان تم إدخال بعض المستلزمات ولكنها بسيطة وقليلة. نحن بحاجة ماسة جدا لإدخال الطواقم الجراحية حتى نستطيع أن نقدم أو ننقذ ما يمكن إنقاذه من المرضى المصابين.
The UN Office for the Coordination of Humanitarian Affairs is alarmed by ongoing attacks across the Gaza Strip that have left scores of Palestinians dead. Our colleagues are telling us that an airstrike near Kamal Adwan Hospital in North Gaza Governorate last night reportedly killed dozens of people, including health workers. Today, we're also told by our colleagues that staff, patients, and their companions were forced out of the facility. Significant damage to the hospital has also been reported. Just today, another attempt by the UN to reach parts of North Gaza Governorate were denied by the Israeli authorities. Since early October, most UN-coordinated attempts to access these areas have been denied. The few exceptions have faced significant impediments, which often prevent teams from accomplishing the work they set out to do. Last night, another attack was reported in the Sheikh Radwan area of Gaza City. OCHA visited the area and noted that overstretched health facilities were receiving mass casualties from the strike. OCHA's team in Gaza City also assessed the needs of people displaced from North Gaza Governorate, which has been under siege, as we've mentioned here, for several weeks. The team in Gaza City said that few water wells are operating in areas where displaced people have gathered and the sewage network has been damaged. There is no solid waste management, hospitals are overcrowded, and people are living in unsanitary conditions that are raising the risk of disease outbreaks. Our colleagues also tell us that people at displacement sites also face risks due to potential flooding. We continue to call on all parties to comply with their obligation to respect and protect in all circumstances medical personnel and medical units, including hospitals and health facilities. Kamal Adwan is one of the last, if not the last, hospitals that was operating in this part of Gaza. Sick and injured children are going into this hospital. We're going into this hospital to get treatment. Sick and injured men, women were also going there with medical personnel, risking their lives in some cases to continue to provide services to people who really need it. And this is why we continue to call for an immediate ceasefire in Gaza. We continue to call for the protection of all medical facilities in Gaza.